in your medical care journey. Don't be uncertain. You absolutely should claim autonomy for you. And if your doctor's not comfortable with you having autonomy, you need to find another doctor. Because truly, autonomy on the part of the patient in the exam room has been annihilated. And there is no Band-Aid that's going to fix it. You have to. Hi, Dr. Scott Jensen here with the Dr. Scott Jensen podcast. It's good to be with you again. I indicated a long time ago that this podcast was going to focus on a variety of things, but in large part, we're going to focus on health freedom. We are going to at times discuss parental freedom. We're going to discuss the healthcare system, not just in America, but across the globe. So, what I want to do over the next few months is I want to do a 3-part series on healthcare. And the title of this 3-part series is Band-Aids Can't Fix the Cancer Afflicting the United States Healthcare System. Think about that. If a person were bleeding to death, if a person had an obvious fracture of long bones, nobody would reach for a Band-Aid. And yet it seems to me like that's what's happening in our system today. Our politicians don't want to discuss it. I was in the Senate when I saw the hullabaloo that took place regarding the issue of pre-existing conditions. I told senators on both sides of the aisle that we had to absolutely address that issue. How wrong is it that someone who, through no fault of their own, develops a disease that never goes away, that once diagnosed becomes a part of that person's medical record till they die? It is forever a pre-existing condition. And yet, the politicians didn't want to address that because it was fraught with danger. We're seeing the same thing today. We're seeing a discussion about this, and this, but the last thing anybody wants to talk about, it seems, is what about the 28-year-old who's trying to have a family and he or she comes down with appendicitis? And as they were trying to budget their dollars and make decisions as to how to make everything work, neglected to pay for an insurance premium for 6 months because it just didn't fit into their budget. So they get an appendectomy at the hospital. Maybe they wait a little too long and the appendix is ruptured. And instead of being able to have it be literally a same-day procedure, they're in the hospital for 3 or 4 days with intravenous antibiotics. And they get a bill for $50,000. How does a 28-year-old deal with that? How does American society deal with that? How do we compare that 28-year-old who is trying to do the right things, get a job, raise a family, take care of the family? How does that compare with how American policies relate to other groups of people? How does that compare to how we do or don't take care of our veterans? How does that compare with how we do or don't take care of illegal, undocumented immigrants? These are questions that we should be asking, but we're not. So I've decided I'm going to do a 3-part series. The first chapter is today. And today I'm going to talk about autonomy annihilated. I think that literally we have policymakers and politicians who think that Band-Aids can fix the cancer that afflicts our healthcare. I don't think it can be done. If we're going to fix our healthcare system, I think it's going to have to come from everyday Americans. And it's going to have to come from everyone, every day, all the time. And we're going to have to force our politicians to have uncomfortable conversations because it matters. So let's start today. Autonomy annihilated. When I think of autonomy, I think of the freedom to choose for myself. That's autonomy. We want that in virtually every aspect of our lives, whether we're talking about our job, our work, whether we talk about what we can and cannot do, where we can and cannot go, what decisions we do or don't make. That's autonomy. I want to read a little bit from Autumn Miller. This was an article in the Substack Sensible Medicine from July 12th, 2024. And the title of her essay was "The Doctor and Her Computer Will See You Now." Autumn Miller says the following things. Autonomy is important to me. With autonomy comes responsibility. I need to do the adulting task of scheduling my annual doctor's visit. I'm dreading it. I'm procrastinating. I don't want to go. There was a time when I admired those in white coats. I held doctors in high regard. Now, I'm not so sure. Trust must be earned. At my next doctor's visit, I know we will disagree about various guidelines. Will my doctor be a partner and an ally with me? Can we agree to disagree? I doubt it. I'm sure I will get the eye roll or the heavy sigh. I will feel her disappointment. I don't trust the system that produced the doctor that treats me like a number rather than a person with autonomy. I don't trust the computer that my doctor now taps on during our entire visit. My doctor parrots the information that comes from the consensus of recommendations being displayed on the screen. She, too, has lost her autonomy. To be able to function as a doctor in this world, she must hold the medical community and all their guidelines in high regard. But at what cost? The healthcare system is broken. Those are words from Autumn Miller. She's a retired educator. She's earned a BA and a JD from Arizona State University. And I was struck by her plea for just common decency. There were a couple of responses to her on social media. Here was one from a woman named Maggie. I really enjoyed reading this. I am a Gen X female doctor, and I feel your frustration from both sides of the computer. The way we are pushed to meet metrics is dreadful. I will often say, this is your child. It is always your decision, because it is. We doctors are highly trained and well-educated, and it makes many of us bossy. We should be educating and listening. That takes time, which we often don't have. Keep fighting for that autonomy. It's worth the effort. And if your doctor won't listen to you, even after you've tried to explain yourself, find a new one. Here's another response from a woman named Doris, also an MD. Medicine is an art as well as a science. We have to tailor our guidance based on our patient's individual needs. It's about autonomy. It matters hugely to people. If you go to the doctor and you think that you have depression or anxiety, sadness, perhaps you have situational grief, a friend died, a parent died, a spouse is suffering from an illness that will not go away, that will never be cured, a child is ill, a friend is broken, whatever. If you go to a doctor and want to simply talk to that doctor about your sadness, your grief, your anxiety, your depression, oftentimes you'll get what's called a PHQ-9. That's a form like this. Pretty impersonal, but there's 9 items that you'll have to respond to. And they'll ask you about, do you feel down? Do you fall asleep easily? Do you sleep too much? Do you have little energy? Are you overeating? Do you feel bad about yourself? Do you have trouble concentrating? We won't talk to you about this. We'll just hand you the hand you the survey and say, we'll give you a couple of minutes to fill it out and we'll come back in. When we're done, we'll look at it. And if you do the first column and you say not at all, we'll give you 0 points for that item. Several days you get 1. More than half the days you get 2. And if it's nearly every day, then you get 3, and we add them up. And if you hit a certain number, we say, oh yeah, you're depressed. If that doesn't prove what we want it to, then we'll go with a GAD-7 anxiety score. And on that one, we'll ask things like, do you feel nervous? Do you have trouble relaxing? Are you irritable? Are you feeling afraid? We're not likely to talk to you. We might even have you do these surveys on a computer so you can just tap your responses right in so that we've got them all recorded. Does recording those responses help us take care of you? Not necessarily, but it helps document it. And the documentation is what drives what we charge for the visit. And what we charge for the visit drives our revenue. And the revenue drives our salary. And the salary oftentimes drives our satisfaction with the current job situation that we're in as physicians. But when you go to see the doctor, oftentimes you will not have the autonomy, the freedom to say, hey, can we put this stuff aside and just have a conversation? I oftentimes tell patients, be careful what you tell the doctor, because in these days, what you tell the doctor is not as sacrosanct as we might think it to be. How many times have you heard about a hospital or a medical clinic's electronic medical record being hacked into? Those are big issues. But I want to talk more about autonomy, specifically as it relates to depression. When we screen universally for depression, oftentimes it leads to unnecessary harm. There's an article on May 26, 2024 by a fellow named Will Ward, and he talked about the United States Preventive Services Task Force when they first recommended depression screening 22 years ago. Now the practice has become standard in primary care, despite an absence of evidence. The fact is, in some clinics, if you come in and say that you're anxious, you will have to fill out the depression survey, the PHQ-9. The article says this: depression screening was first recommended to adults in 2002. 7 years later, in 2009, it was expanded to include children as young as 12 years old. At this point, the United States Preventive Services Task Force admitted this recommendation was based on no studies that evaluated the direct benefits of screening, compared with no screening or usual care. In October of 2022, you remember those days? 2 years ago? COVID's still screaming along. The USPSTF, United States Preventive Services Task Force, recommended childhood anxiety screening starting at 8 years of age. So if your kid goes in, 8 years of age, it's going to get screened for anxiety. In June of 2023, the same was recommended to adults. So now everybody's going to be screened for depression, they're going to be screened for anxiety, and you might have gone in to see the doctor because you had hangnail. For both recommendations, the United States Preventive Services Task Force found no studies that directly evaluated the benefits of screening for anxiety disorders. In other words, your autonomy, your freedom to help shape what goes on in the encounter was pushed aside so that we can do our screenings, our surveys. If a doctor only has 12 minutes to spend time with you and 3 of them are spent on surveys that you're not even interested in, is that really where you want to be? Do you feel autonomous? A 2008 Cochrane review. Now, a Cochrane review is a highly regarded review of lots of studies, lots of literature. It's sort of a meta review. We call that in medicine. They found that adult depression screening does not improve outcomes. I'm going to say that again. A 2008 Cochrane review said depression screening does not improve outcomes. So why are we doing it? Why are we taking away your autonomy to decide what kind of shape you want your patient-doctor encounter to take? Article in BMC Medicine highlighted the lack of evidence. Said, here's a title to an article: there are no randomized controlled trials that support the United States Preventive Services Task Force guideline on screening for depression in primary care. Perhaps we could agree that in a psychiatric office, screening for depression makes a lot of sense. But in a family practice office, screening everybody that comes through the exam door may not make any sense at all. And it definitely whittles away at your autonomy, particularly if it reduces the amount of time the doctor has to devote to your agenda. Now, I probably don't need to say this, but I'm going to, just because I've been under a little bit of a microscope. But what I'm offering to you is simply my opinion. I'm not giving you medical advice. If you construe anything I've said to be medical advice, please go to your doctor and talk to them about it. In a 2007 Lancet trial, United Kingdom military were randomized to post-deployment depression screening or no screening. So when you got done with your military service, post-deployment, depression screening or not. Similar mental health services were available to both groups. So you either got screened or you didn't. Screening had no impact on depression, had no impact on anxiety. Outside the United States, it seems understood that depression screening does not lead to better outcomes. But we keep doing it. And there's more. We misdiagnose with screening. So now you come in for something. We screen you for something you didn't think you need to be screened for. And then we issue a diagnosis that may not even be correct. The PHQ-9 survey that I talked about earlier for depression is known to overestimate the true prevalence of depression by a factor of 200%. So every person that has depression will diagnose 2 with it. Screening exposes patients to harm from overdiagnosis. What happens when we overdiagnose? Well, we overtreat. What does that mean? We're putting people on antidepressants and drugs that they may not need to be on. The FDA recently approved escitalopram, an SSRI antidepressant drug, a selective serotonin reuptake inhibitor antidepressant drug. They approved it, escitalopram, for pediatric generalized anxiety disorder. They did this based on an 8-week trial that found the medication increased suicidal ideation by 6-fold. So, in other words, the FDA approved escitalopram for generalized anxiety for the pediatric population based simply on an 8-week trial that did indeed find that the medication increased suicidal thoughts by 600%. This is what happens when your autonomy is afflicted. In the 19th century, Oliver Wendell Holmes said, if the whole medical material as now used could be sunk to the bottom of the sea, it would be so much better for mankind and all the worse for the fishes. My friends, if you're uncertain whether or not you should stand up for autonomy in the care of your body, in your medical care journey, don't be uncertain. You absolutely should claim autonomy for you. And if your doctor's not comfortable with you having autonomy, you need to find another doctor. Because truly, autonomy on the part of the patient in the exam room has been annihilated. And there is no Band-Aid that's going to fix it. You have to. Dr. Scott Jensen, thank you very much.